because each of us is unique in our body chemistry and our constitution, we find it important to screen every patient individually for the materials we use. So for example, before we would administer Novocaine, we're going to test from amongst the anesthetics that we have in the office to find which particular type of Novocaine is best suited for you. Because we'll often find people are sensitive to one, but perhaps not another. Some of the anesthetics that we use in dentistry have to be broken down by the liver in order for the body to excrete it. Some people, if they have a compromised function of their liver, or if they are predisposed because they have an MTHFR variant, they tend to be more sensitive to those forms of anesthetic. Other forms of anesthetic don't get broken down by the liver, but they may have other ingredients that cause an individual to be sensitive to them. So it's always a matter of finding what's best for you. Similar with the filling materials, when we have people come in who have chemical sensitivities, we're always going to go through a process with them of screening them for the best material for us to use. Often with the blood test, and always with muscle reflex testing or kinesiology.